Welcome to the Jerry Powell Podcast. This is Eric Wadera.
This is Alex Smith.
And Alex, who do we have on the podcast with us to talk about? I was going to give the intro to talk about art and building connection and meaning in medicine. Who do we have with us?
We are delighted to welcome Amy Klein, who is a palliative care doctor and potter. And she's at the University of Arizona and Banner University Medical Center in Tucson, Arizona, where she directs the Palliative Care and Hospice Fellowship. Amy, welcome to the Jerry Powell Podcast.
Thank you so much. I'm really happy to be here.
And we're delighted to welcome Laura Morrison, who's a geriatrician and palliative care doctor at Yale University School of Medicine in Connecticut, and also directs the Hospice and Palliative Medicine Fellowship there. Laura, welcome to Jerry Powell.
Thank you.
I think we've written about your work. I don't think we've had you on, though, have we? Is this your first?
Not yet. I'm so delighted to be here.
Long overdue. And we're also all three of you are overdue. And we're also delighted to welcome Gordon Wood, who's a palliative care doctor and photographer. And Gordon is at the Northwestern University in Chicago, where he's associate program director for the Hospice and Palliative Medicine Fellowship. Gordon, welcome to the Jerry Powell Podcast.
Excited to be here.
So I'm really excited to talk about this. Mainly because I have no artistic skills or knowledge, but I'm really interested
I have seen some of Eric's drawings.
He can attest
for that.
He can attest. But before we do, we always start off with a song request. Amy, I think you have a song request for Alex.
I do have a song request. My song request is Vincent by Don McLean.
Why did you choose this song?
This is a song I loved actually growing up. My mom used to play it in the house, and it is a song about Vincent van Gogh and shares the story about really who he was and his life, and talked to even about his mental illness, interestingly enough, at a time when it was difficult to talk about it back in the 1970s.
Yeah, I first heard this song, I think maybe the first time, when I was at the Ann Arbor Folk Festival in college at Michigan, and Chet Atkins played it. And he is one of the, pioneers, like a father of fingerstyle guitar where you play melody and you have chords and bass at the same time. And incredible. Michael Hedges had just given a performance and he came out to watch and he was just in awe. Love this song. For those of you listening to the audio only, you get my son Kai playing Hawaiian slack key style guitar with me. And those watching on YouTube, here we go for the live. Starry, starry night, paint your palette blue and gray. Look out on a summer's day with eyes that know the darkness in my soul. Shadows on the hill, sketch the trees and daffodils, catch the breeze and winter chills in colors on the snowy linen land. Now I understand what you tried to say to me. Have you suffered for your sanity? How you tried to set them free. They would not listen, they did not know how. Perhaps they'll listen now.
This song makes a lot more sense to me now, knowing that it's titled Vincent. It's about Vincent van Gogh. I never knew that. See, this is the limitations. I know nothing about art, apparently music, because I didn't even know the title of that.
We will address on this podcast. Can you use art to teach if you are not artistic yourself?
Yeah. And I got to say, I got interested in this. I really wanted this podcast to happen. Alex can attest to that too, because I actually went to Tucson, met with Amy, and she was talking about her use of museum-based education. I forget, was it for med students or fellows or both, Amy?
Mostly fellows. I've done it with our fellowship program for our team, and I've also done it a little bit for the oncology team as well.
So I got excited about it. Amy tried to convince me it was a good idea and I should try it. So I actually went home And, we are lucky. Like, I am a 10-minute walk through some trees to an art museum, the Legion of Honor here, brought fellows to do some teaching in the art museum, knowing I know nothing about art. And it was fabulous. I had each of them split up, find one piece that resonated with them about a patient that we were caring for. They each found a piece. We came together, and then we went from piece to piece, just talking about what about the art kind of resonated with them. And it was great. Like, I want to do that more often. And I'm wondering, like, maybe we can go to each of you. I'll start off with you, Amy. How did you first incorporate kind of art and museum-based teaching into, training of medical professionals?
This hit me when I was at the Harvard Macy program for educators in health professions. And it was just a small breakout optional session that I went to, and it just connected with me, like this idea of using art really as another way to talk about difficult topics. Because I see that as something that we struggle with. Is we know how to teach communication, and we know how to teach about symptoms and how to manage pain, but like there's still tough things that are hard to talk about. And so when we did this, we actually started like even doing this online before we could even actually go into a museum, because it was still the middle of COVID for us. And we sat down as a team and we looked through these art pieces and talked about like things that were like, find a work of art that resembles like a good death. Like, what does that mean to you? Or find a work of art that resonates with somebody that you, like a patient that you really struggle with taking care of. And so it was a way for us to connect and talk about like difficult topics that we don't always feel comfortable talking about in medicine.
And it's interesting because it's not like a docent-led tour of the art museum where you learn all about the artist, and like you're giving a prompt, and it's almost like in your scenario that like the art in front of you serves as like a tool to reflect deeper about like perspective taking, what like a good death is, like all of these really difficult topics, and not necessarily this is what I think the art is trying to say based on my extensive art history knowledge.
You don't have to necessarily be like an art historian or know the details. And I mean, of course, that's, I think, nice, and it gives you another perspective, but I for sure don't know about those things coming in. I connect with like this visual object in front of me.
Yeah. Gordon, if I remember correctly, you had a similar story about how you started incorporating art into training. Is that right? Was it also through Harvard Macy?
Yeah, it was. And it's probably the same session, Amy, that you went to, although back in 2014, and sort of also thought it spoke to a lot of the issues I was trying to teach fellows about, and went back and tried it a bit on my own. I subsequently did what they called, and it's a mouthful, so I wrote it down, the Harvard Macy Art Museum-based Health Professions Education Fellowship.
Snappy title.
Yeah, it rolls off the tongue. But I was part of the first class of that back in 2019. And so that was sort of a more intensive training in this. So I've been doing it since 2014 and had that extra training in 2019, and have really found it helpful for all the reasons that Amy said there.
I want to dive into some of the things that you're doing, Gordon. But before we do, Laura, I'll end with you with this. How did you start incorporating this into your training of professionals?
It's always fun to hear everyone's pathway because there is commonality. I was recruited to Yale to start a brand new hospice and palliative medicine fellowship in 2013. And so I was in a really generative space, and I had already been thinking about hospice and palliative medicine fellowship kind of on a national level, about our competencies. And I knew already, because it had been so meaningful to me, to think about the overlap with the humanities in our training. And, our field is so rich, partly for that reason. And so I arrived knowing I wanted to really bring in a lot of humanities for our fellows. And when I arrived, I would say it was inspiration and good fortune. I very quickly, I think, saw an email come across inviting me, to go to our art museum in New Haven and see what they were doing as far as this education model for our medical students. So I had an experience right away and got to be familiar with the setting and all the museum educators that are at our museum, and made those contacts. And, so essentially we've been having sessions since our first class in 2014. We have 2 workshops a year and gotten to tweak it and play around with it a little bit. And it must have been around 2015 or so. Gordon and I have known each other quite a long time. And I think we discovered we had this interest in common. So we started to partner on thinking about this and building on some other education opportunities around it too on more national level.
Yeah, what I know from the national level is you guys have been doing this at national meetings. Is that right? Bringing in faculty to the museums that the national meeting is at. And
yeah, we started in 2016 with a group of our peer cohorts in the AAHPM LEAD program. So we met at the Art Institute of Chicago and had kind of a mini session. And actually, a number of them have gone on to bring it to their own settings. But then in 2018, we had the first pre-conference at AAHPM at the Boston meeting. And that was at the Museum of Fine Arts in Boston. So that was a huge success and so much fun to create those connections. People were pretty jazzed about it. And then we had a session in 2019 in Orlando where we didn't go to a museum, but we had a session that was on site on interprofessional uses and interdisciplinary team applications. And that had a huge turnout at that assembly. And all these people were so excited about it. So it's kept us going. We had a break obviously for cancellations during COVID. And then we've done it the last 2 years in Phoenix and in Denver. And we're hoping to have it in San Diego as well.
This is great. This is like the highbrow alternative to what Eric and I organize, which is the Jerry Powell pub crawl. you all organize an art museum tour in the local city. That's wonderful.
Well, we love the pub crawl. I mean, I think both parts are critical.
I was going to say, it sounds like it's like a nice pairing. Like you can go to the art museum one day and the next day you go on the pub crawl. Like I think that encapsulates it.
Yeah, you probably want to do it in that order and not the opposite order.
Why it's a pre-con.
so I got to ask, like for the one in Denver that you did, you bring in faculty to the art museum. What were you hoping to accomplish? And can you describe a little bit of what you actually did? Gordon, I'm going to turn to you for that.
Sure. So, I think what you're hoping to accomplish with these activities, can vary. And sort of that's one of the big points is that you should have some idea of what you're trying to do. For the one in Denver, it was about sort of finding connection to your colleagues, finding meaning in your work, some self-care stuff. And we did an activity called Visual Thinking Strategies, where we sort of broke the group up into smaller groups with a facilitator, and you'd go to a piece of work for about 20 minutes and have a facilitated discussion there with a sort of set facilitation method.
And was the facilitator another, palliative care faculty, or was it somebody from the museum?
In this case, it was palliative care faculty. Laura, myself, and some others who have interest in this and have gone through some training. In an ideal world, it's a partnership with the museum educators, but it varies depending on the abilities of the museum educators at each of your sites and their availability.
Okay, I'm going to ask a really naive, probably stupid question. What is a museum educator? This is the second time I've heard that word.
Yeah, so many museums have people that have this role, and they teach, use the museum as an educational setting. And a lot of it's in K through 12, but other professional settings have used some of these strategies. So it's different than a docent who leads a tour and describes sort of the history of the art. It's someone who's using some of these techniques that we're borrowing from them.
I think to add on to that, I think docents, I believe, are often voluntary, but museum educators are, to my understanding, paid employees, highly valued on museum staffs, and often have at least a master's degree. The one that we've worked with some over time from the Harvard Macy program and who worked with us on that first museum session in Boston has, 2 master's degrees, one in education and another one, and is just, very sophisticated about all of these pedagogical models for education.
And do you have to pay the museum to use these people, or are these just part of the job description that they're going to be working with groups like yours and K through 12?
I think as Gordon said, and Amy may comment from her setting, it depends on the setting. At Yale, like you, Eric, we're so fortunate. We literally walk 2 blocks and we have 2 free museums right there. So it's just super easy. And those museum educators are happy to work with us for free. That's not always easy. And for like our national meetings, we would find a way, to compensate them in some way if they were able to participate with us.
I'll say we started out when we partnered with our first museum, we partnered with the local community museum in town in Tucson, which is a fantastic museum. And I'll say that I didn't quite have the experience I wanted our first time we did that. And so you might not hit it the first time, but
can I ask generally what happened?
I mean, I think we had a great session, but what happened was that I think, they had come to expect us. But when you asked, do you have to pay people? We still paid for admission. We paid full price for admission. We went to the museum. And even though we'd had a discussion and we're planning to come there, they seemed like they forgot that we were coming. And so we were fine anyway, but it just seemed like they were not as familiar with working in that way of what we were looking for. And so now we currently are in planning of actually going in about 2 weeks from now to our local museum here at the University of Arizona that's associated with the university. And it's a much smaller museum and has many more limited exhibits, but very high quality. They have a lot of fantastic work. And I've been speaking with their educator who's there, who feels very much more familiar with a lot of the things that I'm sure we're going to discuss.
Yeah.
And so it seems like it's a much better fit for us to really go there. And I feel really confident that we're going to have a much better partnership.
And I ask,
go ahead, Alex.
This is if you were going to ask a question that's a continuation, you should, because I was going to ask for a case.
I want to finish off because where I left off with Gordon, I asked him, is he using faculty or these educators? He uses faculty for this session at HPM. What did you actually do again? Because we never finished that part off.
Yeah, so we started with one piece, spent about 20 minutes or so looking at it closely. And
20 minutes?
Yeah, at one piece, which is something that most people haven't done.
Looking at the piece in silence?
No, there's a sort of a facilitate discussion where there's 3 questions in this VTS, visual thinking strategies method, where you ask what's going on in this picture, what do you see that makes you say that, and what more can we find? And then you do, as a facilitator, some paraphrasing and guiding of the group discussion. And, people sort of get this deeper understanding the longer they look and the longer they hear from other people. And then there's sort of obvious parallels to our work in medicine where, our team brings in different perspectives and we see a situation more deeply if we look more closely. And so we use that as sort of a grounding exercise. And then we did something similar. It sounds like what you did, Eric, which is called a personal responses tour, where we had some prompts that we handed out and they went and found art that spoke to their life, outside of medicine or a challenging part of their job or something that allowed people to sort of reflect and share and build some of that connection and meaning. I don't know what you'd add to that, Laura.
I think that's a great description. we have found those exercises to just have so much richness with really any group. And I mean, it's always, no matter how experienced or comfortable you are with art, I mean, just taking that time to pause. And even I would just back up even from that, these opportunities just to walk into the museum space. That hidden curriculum component is there as well. And so there's always this.
What part of that? Because I got to say that my biggest issue with museums, I visit a lot of museums. It's kind of like the opposite of what Gordon was describing with the 20 minutes with one piece. Like you walk around, you see an overload of tons of pictures. You're not spending much time with like any one of them. You're not 100% sure what you're looking at with some of it.
It's the Ferris Bueller model, right?
It is, right? I was actually just in Chicago, went to the museum, like looked at all the stuff. And I got to say, I went with Paul Tatum. For those who don't know Paul Tatum, great guy, Paul. Knows a ton about art, but he did this really wonderful thing. Like all of us, I went with my 16-year-old kid, my wife. I was kind of done. And he's all, we'll go into 4 rooms. Each of us is going to pick one thing in one room. So somebody has that room. And you have to say, like, why did you pick this thing? And all of a sudden, it magically transformed the museum into like, it's a little bit of a treasure hunt, but also there was some meaning now for all of this stuff that though we were looking at, and we're incorporating our meaning into that. And it completely changed the way I thought about that museum.
Mm-hmm.
So Laura, when you say like walking into the museum,
like, my kids say, why is it that gravity is heavier in museums than outside of museums?
Time moves slower.
They just you're attracted to benches and have to sit down.
Well, obviously you have to respect each and every person's individual experience. But I think as an educator, you're hoping that by giving the opportunity for your fellows, for instance, to just step out of the hospital or out of the clinic into this other space gives them a chance to transition, take a little stock in how they're like feeling physically maybe, and like breathe differently. Now you may feel it's heavier in a museum. I tend to feel like there's more space, but again, everyone may experience it differently. But the number one thing is just to switch the environment, the learning environment. And then, as Gordon and Amy have both mentioned, I mean, it's really about connection and meaning. So, who's to say what connection is made by each person? But by sending you into a room and giving you this space to choose something that you connect to and then share if you're comfortable, that's kind of really where the richness is, at least in my experience.
And I also think that, there is that feeling when you go through museums, like I just got to see everything. And there's like a little bit of that confusion, like, oh, I don't know what that means. I don't know what is happening in that painting. And I think the really interesting thing about doing this is like you dive deeper into that, right? Like there is that sense of, I don't know what this means. Okay, like let me sit with that for a moment. Like, is there a connection with this that I can find? And my first thought is, I don't know what the artist is trying to say, but what do I take from this piece in this moment that has a connection with me or that connects in some way? Or like if you're thinking about what Gordon was describing with visual thinking strategies, like what does this mean? Like, how can I explore this and spend some time with this piece of art that maybe there isn't a clear story that I can take right away, but can I dive into that a little bit more? And I think that very much relates to what we do in medicine, right? Like we see that all the time.
And am I okay if there's no answer, if there's ambiguity?
Mm-hmm.
That's actually one of the findings in some of the studies that have been done, is people have, even in, I think, sort of free text responses said, I found myself getting more comfortable with uncertainty. But sometimes it's also the specific learning objective is to help people really dive into that uncertainty a bit more. So,
yeah, there's a tolerance for ambiguity scale, believe it or not. So,
really?
Yeah.
I feel like mine changes every day. Maybe every half an hour.
Every podcast.
Yeah. Speaking of which, Alex, I'll let you ask your question.
So I'd love for, like, part of the richness of this, like, what will convince our listeners are stories, right? Like, this experience was transformative for me or for one of the people I was taking through the museum. And could we each just tell such a story? I'll go first. One of my mentees, Ashwin Kotwal, who's been on this podcast many times, geriatrician, palliative care doc, studies loneliness and social isolation. And I remember seeing like a series of Edward Hopper paintings about like that just captured visually the loneliness and isolation of modern life, you know, like woman sitting in a cafe, you know, shot through the window, sitting by herself. And just the mood, the way, the empty space around her, and it captured so well that experience, that emotion. It just drove it home to me, you know, right? In like a way that a dry manuscript might not. And animates it. It brings it to life. It makes it real by evoking that sensibility. That's one for me. Eric and I did a retreat where we had somebody guide us through one of these paintings using those questions you mentioned, Gordon. What's going on in this painting? What do you see that makes you say that? And what more can you find? And at the beginning of that session, I thought it was a guy eating a hot dog. And by the end, it was like an incredibly rich painting with this whole history and whatever. I was just blown away. So those are my two examples. Who wants to go next? Just dive in.
I'll share that when we went last year as a team and as a palliative care team, and we ended the day really with asking the team for everybody to go through anywhere in the museum. We gave people some time and we asked them to find a work of art that really resonated with how they were feeling at this moment in their life. And part of it was really, I think everybody has their individual struggles and pieces. And I remember for me personally, I was going through and I wasn't connecting with a lot of things for where I was at that moment. And then all of a sudden I saw this painting of a woman who was sitting on a bench, and she looked like she was just waiting. And I remember just feeling so deeply connected to that at that moment, because I felt like, oh my gosh, that's me right now. I'm just sitting on this bench in my life. I don't know what I'm waiting for. She looked like she was just kind of lost. She looked like she was put together and just kind of waiting for the next thing and not knowing what was going to happen. And what was interesting was I felt very connected with that. But then when we went through and shared our experiences, as a team going around, I think it really helped my team feel much more deeply connected to where I was at, which is something that I hadn't been able to like put a word to and really talk about that experience of how I was feeling. And so I think it really did have that sense of bringing us together and building us as a team, which was so much more helpful for me. And we could talk about it afterward. Like we were able to come back and talk about it as a team, like, oh, I saw this, or oh, we saw this, or oh, yes, let me share more about this story that we shared in the museum. And so I think it really helped us build a connection as a team, which I felt were very deeply.
That's amazing. And it speaks to like how this operates on so many levels. There's a little bit of the Sherlock Holmesy, like what's going on in this painting, which is fun. And then there's also, so it's like the individual interacting with the painting and then the group trying to puzzle it out, but also this like across the group experience and sharing of understanding and emotion and team building, as you're saying, Amy. That's great. All right. Yeah. Who's next?
I might sort of build off that because what I thought of as similar is, so every year we bring all the fellows from what's called the Regional Fellows Conference in Chicago. So we're lucky in Chicago that the fellows from Rush Stroger and University of Chicago and Northwestern get together sort of for monthly didactics. And so we bring about 12 fellows at the start of the year in August to the museum for one of these sessions. And it's sort of every year now we see this phenomenon happen where they don't really know each other by August, and they're still trying to figure out everything, and then they sort of looking at them before the session and then after the session is just amazing. And they say this in their reflections about how they sort of got to know each other on a much deeper level, and they feel so much more connected as a group. And, I think that's one of our main goals, and one of what gives us joy in medicine is sort of the connections that we have, like Laura and I working on this for so long, so that they're sort of starting to build these connections. And my hope is that persists through time for them. But it's just that change. And I've heard Jane DeLima Thomas talk about that with their Harvard interprofessional program too, where it sort of brings their team together, knocks down all the hierarchy between the different, groups, and does something really magical.
Mm.
Yeah, and similarly, but a little different, in our group, initially we just had 2 fellows, and I would, try to encourage some of our team members to come as well. Now we have 3, and occasionally we still have team members. But this last year, we do our first one in the first week or 2 of orientation, so they don't know each other that well yet. And recently, I've been asking on the personal response tour part, can you...
That's when they pick a picture and then they come back to talk about it. Yeah.
So I give them the prompt of, find, browse in this area, find a piece of art that speaks to you about your path to palliative care fellowship. What brought you here? So they share those stories. But one year, the fellows just were even more reflective, I guess, than usual. And we had, tears for multiple people, and really speaking about personal losses. There's, storytelling, a lot of sharing about really what had brought them to today. And that was, it was just really meaningful. So I think, speaking to one of the opportunities in this space is the emotion. And that's also one of those areas to be a bit cautious, because when we lead these sessions, we need to be prepared. Someone could also, of course, have a challenging response or be activated in a negative way.
Well, I feel like as faculty and educators, we see that, we see it in the hospital. Like we should be managing that in the hospital. I wonder, how much art background do you need too? Like if Alex is talking about this man eating a hot dog and, all these different meanings, but it's actually like an ad for the cafeteria hot dog. Does that matter at all? How much do you actually need to know about the art, and how important is it that you include the museum's educator?
So I would say that the training that I think is helpful is more about the education than about the art. So the Harvard Macy Fellowship thing that I did was not at all about art history. It was about how to do this visual thinking strategies and how to introduce, people to the museum, and how to manage some of these things as they come up, and how to match your activities that you choose to the objectives that you have. And so none of it was about art history.
Yeah.
And in fact, I would add, when we usually start a session, one of the sort of important context setting things is to let everyone know who's participating that you don't need to be an art expert to do this. If you've never been in an art museum before, this is fine, welcome. You don't have to be totally comfortable being here either. So, this is just about an experience to create connection.
Yeah. And that's how Amy convinced me to do it, or to try it out. You actually don't need to know anything about art.
Which is good, because I don't know anything about art for the most part. But we had people in our group who do know a lot about art, who are very comfortable, who, can speak to this piece that they recognize. And we have people who absolutely know nothing and have really never been in an art museum before. And so I think you can come from a lot of different backgrounds. And even as a facilitator, you don't have to necessarily be an art historian to try this.
Yeah.
Can I go back to something Laura said about the tears and the strong emotions that were evoked when you had newly minted palliative care fellows talk about their journey to palliative care? And that there is sort of a wounded healer archetype of people who often go into palliative care who have these wounds and stories that might be opened up.
In a public setting.
In a public setting, yes, with people they don't know very well. Because
but even like random public people all around you, right? Like this is not a private, they didn't close the museum for you.
Yes. Are these kind of the risks and potential harms? We were talking about a little bit before we started the podcast that there might be some risks and harms to this exercise, which was stunning to me. I hadn't considered that. Well, you know, you're going to a museum and look at art. Like how dangerous can that be? More thoughts about that?
Yeah, I know others may want to add to it. I think, as Gordon was saying, the role of a museum educator can be helpful, or even having a co-facilitator. But I've run quite a few of these sessions just myself when our museum educator hasn't been available. So, I mean, I think it's doable, but the main thing is just to have that awareness. I think people can get really excited about, oh, this sounds so cool. And it's just about realizing that it's the whole human experience, right? And there's this potential for people to be activated. And I think especially one of the really wonderful opportunities around these art teaching spaces is that we can explore biases and racism and classism and all these challenging tensions in our society right now. But those are sensitive discussions as well. So even how people share what they observe in front of them in a piece can potentially not maybe sit well with someone who's next to them, you know, so it can be quite a sensitive space. And it's not like any of us are really experts at handling everything that could happen, but it's about that awareness and at least being kind of set to be looking for things that could pop up ahead.
What do you think, Gordon?
Yeah, I was just going to say, I think the other piece of that is sort of the setup. That we do a lot of sort of work up front to sort of set up the activity and what it may bring up things and sort of try to create a safe space. So there's the sort of managing it if it happens, and also the setup.
So let me ask you this, Gordon, because what I did for mine, so Amy got me really interested in this. I was really scared. I thought the risks and harms were, to me, like people were going to think I am a terrible faculty in palliative care. Remove me from any component of the fellowship. And people would laugh at me at my lack of knowledge about any of this. But it actually turned out really well. So I looked up some of the curriculum. I figured out like the ones I felt like I can do. Like, what's it called again when you go around, you pick an item?
Personal responses tour.
Personal responses tour. I did a prompt. We had people go around. We recombined.
Your prompt again, Eric, was...
Find a piece of art that resonated with you because it reminded you like of a patient that you cared for, or a challenging situation. It was kind of I would probably refine that a little bit more next time, but it worked really well. The only downside is the fellows really wanted to go to the cafeteria and get a piece of cake in between, but the cafeteria was closed. Next time I'll make sure it's open. But like, was there any harm that I should be thinking about before I did that? Because if I'm going to do it again, or if other people are interested in trying, which seemed like a very like baby step thing, like this personal response. Again, I feel like most palliative care providers should be like acknowledging emotions and preparing people. Or do you think, no, you actually need more training? I should have done like the Harvard Macy very long thing before I jumped into this.
Yeah. I mean, I want to say we're blessed in our field to have wonderful educators. And as you say, we're sort of as a field in tune to some of these things. So there's many people I think that can do really well with this. I think the risks are, depending on which activities you choose, some are harder to facilitate than others. Like the VTS is a little bit harder. So you could...
What's VTS again?
That's the visual thinking strategies, those 3 questions, which sounds really simple, but is actually a little bit challenging. So you could be an ineffective teacher, but even like with something that you did, that could trigger some sort of wounded healer thing like Alex was mentioning that really brings up a personal story. And there may be a different role that you play, like as a palliative care clinician, if somebody gets that emotional versus as an educator in a museum. And
the one thing that felt very, very different to me in the museum is that you're surrounded by random people. So when emotions come up, you're not like in a small classroom where you can just talk about it or a one-to-one. How do you deal with that? Like, you are in a very public setting.
Yeah. So, I mean, it'd be interesting to see what Amy and Laura think, but I think that, you've set it up, your group is, while in a public setting, is sort of a little cocoon within that setting. And when I've sort of seen it go well, the group is caring for each other, and you're sort of acknowledging but not doing psychotherapy in the moment, and sort of supporting each other and sort of moving on and sort of giving people space to share what they feel comfortable sharing and not pushing where they don't want to go, I think.
You might debrief a little bit later, but often I think if you set it up well, people know that it's safe, and I think you kind of move on. You don't over focus on it, and you kind of move on to the next person to share, and everyone's safe.
Yeah.
Sorry, Amy, go ahead.
No, I was just going to say, I think we also, in our field, I think most people come to this with a skill set of truly having that empathy and having a lot of that feeling of connection to people around them. And I would think that a lot of us naturally are paying attention to those things, whether you've tried to turn it on or not, like we're all paying attention to those things at all moments in time. Yeah. And so I don't think that when you go into a museum that you're turning that off. I think that feeling is still there, that paying attention, trying to take care of the people around you. Like, I think a lot of those come very naturally to people really in this field as we see patients as well, and as we take care of each other as a team, because this is always a team-based sport, what we do. And so I think a lot of those translate really well when you come together in a group. And I just want to emphasize, like, what Laura was talking about, like, it really gives you, I think art is a way, I mean, when I look at art, it's not about it has to be good. It's like you're interpreting this feeling or this story or this topic into really an object, into a thing. And it's a way to objectify this experience so that we can deal with it. And we have these experiences all the time that are really hard to deal with. Yeah. We deal with a lot of suffering. We deal with a lot of terrible experiences our patients are going through. And so I think there's certainly a little bit of a release in being able to actually just talk about it, to put it out there, to talk about like this other third object and say, like, here's what I was feeling at that moment when I had this patient experience that I've not been able to discuss even from 2 years ago, which has come up for our group.
Okay, Alex, I got a question for you. Next time you're attending on the palliative care service, is there anything you want to know, like if you're interested in doing this with the fellows, from Laura, Amy, or Gordon?
Yes, I want to know good prompts, and I've been writing some down. I don't think I can do you go to one piece of art and say, what's going on in this painting? What do you see that makes you say that? And what more can you find?
That's the VTS.
Yeah, I prefer the other approaches. And I'll tell you what I do with my family. When we go on vacation, we'll go to like art stores, and go to galleries, and we'll say, all right, everybody choose your favorite painting. And on 3, we'll all point to it. And then we all point, and we almost always point at different paintings, and then we say why. Yeah. It sounds very similar to what you've done. Some other prompts I've heard so far are find a piece of art that resonates with you because it reminds you of a patient you've cared for or a challenging situation. I heard find a piece of art about the good death. Can you tell me other prompts that are good to get people going in this activity?
The possibilities are kind of endless, I think. It's just, you can ask, is there one that resonates with you about a joyful patient interaction you had? Mm. Or a patient where you had a deep connection. Mm-hmm. The challenging patient situation or a challenge in the field for you is another one. I liked the one Gordon mentioned before about, your life outside of palliative care, something that speaks to you about that.
I think one of the ones that we did at the Denver session during the pre-conference was find a piece of art that makes you think about community. And it doesn't necessarily have to be something deep or intense. It can be very broad and open. And I think it kind of depends on, like, what are your objectives for that session? And they can really vary. They can be based on team building. They can be based on, like, just exploring as kind of what community or meaning is, or joy in patient care. You know, they can be a lot of different things.
And Gordon, that kind of goes to what you were saying earlier. It's thinking about kind of like, why are you doing this? What's the objective? That educational curriculum part, like, it's a curriculum. You have to think about that before you go. Is that right?
Exactly. Yeah. No, I mean, if you might be thinking about sort of the impact of racism or something like that, and you might have prompts about, find a piece of work that speaks to the impact of racism in palliative care or something like that. And so you have to really think, what am I trying to get out of this session? And there are a slew of other activities, so it's not just these two that we've mentioned, but you want to fit the activity and the prompts and everything to what you're trying to achieve.
Wonderful. Well, Laura, Amy, Gordon, thanks for being on this podcast. But before we end, we're going to do a little bit more Starry, Starry Night. Vincent is the actual title. I always thought it was Starry, Starry Night. So
I thought so too.
I still accidentally look it up that way, even though I knew it was titled Vincent. All right, here's a little more. Starry, starry night, flaming flowers that brightly blaze, swirling clouds in violet haze, reflect in Vincent's eyes of china blue, colors changing hue. Morning fields of amber grain, weathered faces lined in pain, are soothed beneath the artist's loving hand. Now I understand what you tried to say to me, how you suffered for your sanity, how you tried to set them free. They would not listen, they did not know how. Perhaps they listen now.
fantastic. Completely different idea what that song is. Thank you, Amy, for picking it. Laura, Gordon, thanks for joining us on this podcast.
Thank you.
Thank you.
Thank you.
And thank you to all of our listeners for your continued support. We'd also like to say a big thank you to those who've donated more than $250 to the Jerry Pal podcast over the last year, including
Anna Lynch, Deborah and Jeffrey Larson, Krista Mossack, Ed Martin, Stuart Oserman, Mo Rizawi, Rochelle Bernacki, Daryl Owens, Mark Wren, Richard Lewis, John Bielenson, James Tulsky, Elizabeth Cobbs, Christopher Heck, Meg Walhagen, Chris Jones, Kate Mesrich, Jen Hopping, Ashad Abid, Michael Bordofsky, Asher Edwards, Susan Nelson, Harry Hahn, Carol Heyman, Gretchen Schwarzy, Sharon Brangman, Elizabeth Chung, Paul Amatelli, Brian Castle, Victoria Braun, Susan and John McFadden, Christopher Heck, Emise Samoji, Matthew Schuster, Carrie Hagan, and Lloyd Woolstadt.
a very big thank you. And if you too want to donate to the Cherry Pal podcast, please go to the Cherry Pal website and click on the blue or orange donate button.